This video is about low platelets. Some people are diagnosed to have low platelets, and usually that's a symptom or sign of something deeper happening in the body. So, thrombocytopenia is a term we use for low platelets. And platelets are tiny blood cells that help stop bleeding. When platelets levels are low, condition is called thrombocytopenia. And normally, the normal level of platelets is 150,000 to 450,000 per microliter of blood. So when it falls below 150,000, it's called considered low, and is considered very low, a danger zone, when it's below 20,000, and the risk of bleeding goes quite high for spontaneous bleeding. So common symptoms, some people have no symptoms, especially if the drop is mild. Possible signs include easy bruising, tiny red-purple dots on the skin called petechiae, nose or gum bleeding, heavy menstrual bleeding, prolonged bleeding from any cut, severe cases, internal bleeding, which is usually medical emergency. Main causes of low platelets: decreased production, bone marrow problem. Platelets are made in the bone marrow, and causes can be viral infection like a dengue fever, hepatitis, HIV, COVID, vitamin B12 and folic acid deficiency, alcohol access, chemotherapy or radiation, bone marrow disorder, aplastic anemia, leukemia, increased destruction. It could be immune type or consumption type. Platelets are made normally but destroyed too fast. Causes: ITP is one of the most common cause. Immune thrombocytopenic purpura. Body attacks its own platelets. Autoimmune disease like lupus, certain medication, heparin, antibiotics, anti-seizure medication, severe infection or sepsis, pregnancy-related condition called HELP syndrome, sequestration, where the platelets are trapped, like people with the cirrhosis of liver, and they have a huge spleen, and a spleen traps the platelets. Or it could be enlarged spleen from infections or lymphoma or other blood disorder. That can also cause thrombocytopenia because of splenic sequestration. How doctors evaluate low platelets? We repeat complete blood count to make sure there was no lab error. We check peripheral blood smear, liver function test, B12, folic acid, viral test if indicated, like a ruling or hepatitis, bone marrow test only in selected cases, and basically that involves bone marrow biopsy. Treatment options is basically a cause base. What's causing it? Mild cases, observation, treat underlying cause like infection or deficiency, then supplement B12 folic acid. If it is because of immune cells like ITP, steroid like a prednisone is the main treatment, sometimes immunoglobulins, and the newer immune modulating medicine. Deficiency related, supplementation of B12 folic acid. Severe or bleeding cases, patient gets admitted to the hospital and get platelet transfusion. Sometime emergency treatment if there's internal bleeding. When to seek urgent care if platelet is less than 20,000, uncontrolled bleeding, blood in the urine, stool, severe headache or neurological symptoms. So low platelets are not one disease, they are just a sign, and treatment depends entirely on why the platelets are low. Many causes are reversible when identified early. So don't delay, and if that's the case, low platelet issues, definitely stay in touch with your doctor. Maybe you need to see a hematologist. So thank you for joining, and please like, share, and repost. I'll see you in different videos.